Good evening all, welcome to Voiceit talk show. Before we're gonna start, I'm your presenter Stuart tonight, and we just need to do our disclosure that we don't take responsibility for offensive languages or videos with this live streaming. Our COVID-19, our candle on our screen is for all the people that lost their loved ones with the COVID-19 epidemic. And we keep on praying for full recovery, so keep the distance. The purpose of Voiceit talk show, our talk show that will be broadcast in English and in Afrikaans. The show is for any person, organization to voice their opinion in the Free State and around the world. The platform is to share information and knowledge. The viewers are also welcome to interact and ask relevant questions. Tonight's topic is a great controversial topic, the vaccination. Is it a yes or is it a no? Our guest tonight is Mr. Voiceit Malete. He's a Deputy Director, Primary Health Care, Mangaung. I'm first going to quickly read the bio of Mr. Voiceit. Mr. Voiceit Malete is the Deputy Director, Primary Health Care, Mangaung Health Services. He loves sports, TV and reading the Bible. I'm always having interest in people. I'm currently involved in COVID-19 projects in the district and many key health projects. Born and bred in Mongyakeng, Wesselsbron. He got a diploma in nursing science, healthcare management, project management, management development programs, and is 22 years in health. Before we're gonna start, we're gonna just play a slight show of Mr. Voiceit, just to give you a background who he is actually. There you have seen a little bit of Mr. Voiceit here tonight. So before we start, I would like to welcome you on our program, Mr. Voiceit.
I'm very thankful for Voiceit Talk Show. I'm back again. I was here before, and I know that we are still going to work together. I would like to say hi to everyone. We are going to voice it out today.
Thank you so much. Just for interest's sake, we have just seen this afternoon that already in South Africa, we have lost about 70,000 people of the COVID. But immediately to start off, Mr. Voiceit, if I can call you Voiceit, and you can call me Stuart, how many people in South Africa and in the Free State have been vaccinated?
A lot of good work has been done. Good Good evening again, everyone. A lot of good work has been done. So far, 6.6 million people has been vaccinated. We know that we have two types of vaccines. The first one is Pfizer. The Pfizer vaccine, we have vaccinated 4.1 million people, and then with Johnson & Johnson, we have vaccinated 1.2 million people. That is in South Africa. But in Free State, we have a Pfizer, the first doses, we have 226,824 people vaccinated, and the second doses now that we are busy doing them is 66,635 people who are vaccinated. And with the Johnson & Johnson, we have vaccinated now 60,491 people. Yes.
Now, if we can come to a question that's a little bit confusing to the people, or they want to know more, what's the difference between Johnson & Johnson and a Pfizer vaccine?
Yes, we know that all over the world, all vaccines are manufactured differently. And the Pfizer vaccine, you have to get 2 doses. It requires 2 doses and is given in a period of between 3 weeks, that is 21 days, up to 42 days. Then you get your second dose. So that's how it is manufactured for efficacy. But we know that the Pfizer vaccine is about 95% efficient in preventing complication of COVID. And then the Johnson & Johnson, we call it, they said, unlike the mRNA vaccine, Johnson & Johnson, you only require 1 dose. And then we know that is an option for many people want to have Johnson & Johnson because of you have to have 1 dose. But yeah, those are 2 vaccines that we are using in currently in South Africa.
So if you talk about the Johnson, the 1 dose with the Johnson and the 2 doses of the Pfizer, is it the same effect, or is the Pfizer more powerful and sufficient because you wait a while and then you go for the second one?
Yes, Pfizer has got 95% efficacy of preventing people to be complicated from COVID or even to be hospitalized, whilst Johnson & Johnson is 66% in preventing severe symptoms, but it is at 85% in preventing people to be admitted in hospitals whilst we have COVID-19.
So there you hear that the Pfizer is actually a better prevention vaccine than the Johnson, and I think at this stage they are using more the Pfizer than the Johnson & Johnson. But coming to my next question, we realize that there's a lot of side effects that the people get after being vaccinated. Can you explain to us what is the symptoms that they get and how can they prevent it, and what causes it?
Yes, there are, just like with any other vaccine, there are some side effects that you can expect as a person in terms of the vaccination. You know, it has been this well spread information that Johnson & Johnson is causing clots and all that. And it was even paused a little bit, and it was even more researched. And the Center of Disease Control, they sit down and look at it, and then they still feel that after a brief pause, it's still a very safe vaccine to be given. And you must be aware that we all started with Johnson & Johnson as frontline workers. We all vaccinated with including myself. I'm vaccinated with the Johnson & Johnson. So they still felt that it is a safe vaccine. But there are some of the side effects that might happen when you are injected with the vaccine, like shortness of breath, like your blurred vision, severe headache. Sometimes that won't go away. Like your leg swelling, your chest pain, abdominal pain. That sometimes it won't go away when you feel that pain. And then there's some bruising or blood spots. Those are some of the side effects that people can expect. It doesn't mean that they will happen, but it's just they might happen. And how we treat those side effects, that we give them, we treat them with a simple, your Panados and your simple medication that you treat a minor ailment for a person.
What causes it that they get these side effects? What does this injection do to the people?
Yeah, the vaccine is like you introduce something that mimic the condition. Like we know that COVID-19, you have shortness of breath, you'll have sore throat, you'll have that. So when you get the vaccine, because you introduce something like a COVID, it will make your body react as if you have COVID, but it's just a mild symptom that fades away. So that at the same time, when COVID comes, the real COVID comes, you are at least have antibodies that are built against it. So it's just a mimicking COVID when we inject the vaccination, so that your body reacts and form antibodies, and you start having this your sometimes temperature, and sometimes you have the headaches, and you have a swelling side on the side of injection. Some of people have some small annular swelling and all that. So that's how the body reacts to the foreign body that is introduced to the body, so that by the time the real COVID comes, at least you have developed the antibody for against it.
Tell me, the side effects, how long does it take after you receive an injection? A day, a week, a month?
We are always advising people that 14 days after vaccination, you must look at this as side effects and symptoms.
14 days. Okay, so it's not actually 4 days. You must monitor yourself for 14 days after being vaccinated. Can you drink in the meantime? Can you use alcohol? Can you party?
we advise people just to stay as simple as possible during this period, so that we don't miss anything. So it's important that we also observe the COVID regulation of making sure that we are not mixing with the crowds, we are not moving around without masks, and we are always sanitizing our hands, we're washing our hands, we keep the hygiene as good as possible. Because remember, we are just introducing the foreign body. It doesn't mean that you are immune now to COVID. No, it's just that we are introducing the foreign body as a vaccination, so that it mimics your COVID, so that when COVID comes in, your body has already developed antibodies. So it doesn't mean that people will just have to move around and do other things that are not really good for health-wise, in terms of making sure that we don't spread COVID-19.
Tell me, if you get vaccinated afterwards, do you still have the chance in getting the COVID?
Yes, it's possible that you can get COVID. Remember, the purpose of the vaccine is to prevent, and our prevention is clear. We're preventing severe symptoms. If you can have COVID, you prevent that you don't develop severe symptoms. You don't develop, you don't get admitted to hospital. Even 100% preventing you from death. So it's very important. So meaning it can come in but pass without causing you severity and admission and death.
So it's like this injection of getting your yearly cold injection, just to prevent the sickness of a cold, in putting you flat in bed.
Yes.
Something like that.
Yes, the flu vaccine that we always get every year. Because the flu comes with different strains every year, so that's the same. With COVID, it's also the same, that we prevent you, if you have COVID after vaccination, that you don't complicate, you don't get admitted, and then prevent death.
Okay, in the Free State where we are stationed, Voiceit went with the crew and visit Pelanomi Hospital, a very popular hospital in Bloemfontein, where they get vaccinated, just to see how the system works. Let's take a look at this video.
Hi everybody, my name is Melissa Najal. I'm 40 years of age. I'm from Bloemfontein in Hededa. I'm here at Pelanomi, the vaccination site. I'm going to have my first jab. Please, youth, come at my age. Everybody, please, come, let's fight this thing. Thank you.
Also, setšhaba sa South Africa, nna ke ya lebitso ke mme Mosebetsong Sanong, ke dula Bloemfontein mo Chris Hani. Ke tlile go tla fumana nale ya ka ya corona. Ke tlhabile nale ena e tshwere vaccine. So ke kgothaletsa motho e mong le e mong gore a hlabe gore re bone gore na jalo ka go tshwere corona nale ena e tlo lwantsha corona. Re ka se tlhole ka gore re nne re hlabe. Ke kgothaletsa motho e mong le e mong gore a hlabe hobane nna ke hlabile ebile ga o na le matshwao e ke a fumaneng ka morago ntse ke le hantle ka morago ke kgothaletsa motho e mong le e mong gore a hlabe re tle re tsebe go fokotsa bothata bona ba corona.
And again, I would like to encourage people not to listen to false information. You live for yourself. You don't live for other people. Please, guys, please protect yourself, protect your family, and protect the community. I will encourage you guys to come and vaccinate them. I have also vaccinated. I'm well. I have no fear of being vaccinated. And stop listening to this false information. Stop it. Stop. Because with the very false information, you are going nowhere. And to the people out there who doesn't want to vaccinate, I would like to ask you, just shut up, because it's your choice not to vaccinate. And let those who want to vaccinate. Thank you.
You see, people, it's so important, to get news, not from overseas or from another province, in your province, right at your doorstep, of your own people, to encourage you to go and get the vaccine. There's a lady, she's 40, and she's encouraging everybody. There's a elderly woman that says, please come and take this vaccine. It is going to help. And even for the people that are negative about the vaccine, try and convince yourself just to go and take this jab. It is just the solution, like we are saying. And this is Pelanomi. If you have anybody, you just go there. It's at Mankov's. You take your ID. You don't have to make an appointment, and you go and get your first jab, and after that they give you a date and you go and get your second jab. Do you want to comment on that, Stella?
Yes, I'm very excited what I've seen here. Very good for the public and for ourselves as a community, because we are all members of the community, and a very, very, very good area for us to come and vaccinate. So yeah, I'm very excited, and I believe everybody is excited out there to come and to go and vaccinate themselves.
We're going to move quickly to a video clip, how to stop COVID, and then we're going to talk about it again.
COVID-19 continues to spread around the globe. You can help stop COVID-19 by participating in contact tracing. How does contact tracing work? Contact tracing is a system that has been used for decades to stop infectious diseases. A contact is anyone who has had direct physical contact or was within 1 meter for at least 15 minutes with an infected person, even if that person does not have symptoms. This applies to anyone who has had contact from 2 days before a person gets sick until 14 days afterwards, or from the 14 days when an asymptomatic case tested positive. Once you are confirmed as a contact, you will be asked to go into quarantine, which means to separate yourself from others and to monitor your health for any signs of illness. The monitoring ends on the 14th day from your last contact with the person infected with COVID-19. Quarantine can take place in a special facility outside of your home or at home if you can stay separated from family members. Why 14 days of quarantine? It can take from 1 to 14 days from contact with the virus to develop symptoms. During this time, you should stay in quarantine and monitor symptoms and follow instructions given to you if you become symptomatic. Without contact tracing and quarantine, the virus will continue to spread. This leads to more people becoming sick and infecting the most vulnerable. By identifying and limiting contacts of people infected with COVID-19, the virus stops spreading and the community stays safe. To break the chains of transmission, we all need to work together. If you become sick with COVID-19, stay away from others. Follow the recommendations of your medical care provider and share the list of people who you came in close contact with. With your help, we can prevent further spread of the virus and save more people's lives. By acting together, we can break the chains of COVID-19 transmission.
We see there they have given us guidelines how to prevent to get COVID, talking about crowded places, sanitizing, and have a mask. Can you elaborate more on that for us?
Yes. You can build these hospitals, you can build the ICUs, you can build all sorts of facilities. But as long as we don't use simple methods of prevention, we are going nowhere. So the simplest methods of prevention is that we avoid crowds, we avoid crowded areas, and we know where the crowds are. We know that we have our malls, we know where the churches, we know where the crowds are, stadiums, wherever, the chisanyamas and where the car washes. We know all those areas where we know the crowds. So yeah, it's important that we avoid crowds and we keep, when we are in the public spaces, we keep a social distance and we always wear our masks. And we also sanitize and wash our hands frequently, so that we avoid contracting the COVID virus. So very, very important that we respect those, because we can build all these hospitals as long as we don't prevent by following the important COVID regulations. We are not going to win it.
So the most important thing is crowd. That's where the virus can quickly accumulate if it's a crowded place with a lot of people. Yes,
and it loves crowds because it's from person to person. So that is why we have to social distance, and we always make sure that we wear the masks and then we avoid contacts and all that. So and sanitize our hands. So it's important that the crowds are a key for as a key vehicle for spreading the disease and the virus from one person to another. So it's very important.
I want to show you another video first, and then we're going to discuss it of the churches in South Africa.
I greet all the pastors, all the Christian community in the Republic of South Africa. My name is Moafrika Wamaila. We are here to make a very important announcement with all the ministers who are here with me. Thank you.
Please, this is an urgent hour in South Africa. We need our churches open. This Sunday, we are calling pastors to come together in Pretoria. We will announce it. So please, we need to stand up now.
We can't delay this. Christianity is under a serious attack. We need to stand together, pastors, not just for ourselves, but for the sake of the next generation. We cannot allow this to happen anymore.
If we do not stand up and speak now, history will judge us, and it will judge us harshly. Pastors, it is time to rise up and stand for what you believe.
I think this is the hour, this is the time we are born for battle. This is our time to rise. Christianity is an attack, and now is the time to come together and to stand for the Church of Jesus Christ.
We all say now is the time for churches to be opened, and that's our stance.
And on Sunday, all the pastors, the church leaders, the Christian ministers, let us meet at CRC, 8:30. We're going to have a meeting, we're going to address the media, we're going to take a stand. And all the pastors, do not fear, let's come and meet so that we can have a clear stand on continuing with churches to open.
It will be on Sunday, 8:30 in the morning. All of us pastors, if you have a collar, bring your collar. We want to make a strong stand as pastors on that Sunday to say we are here and we're going to defend Christianity like never before.
You see, government have closed a lot of places. They have closed soccer stadiums. They have closed the casinos. I'm an entertainer. It's now my second year not getting any income or any shows because of this COVID thing. They have closed the taverns. They have closed the bars, some restaurants. Coming back to the churches, a church is quite important to attend to. People need spiritual healing. And here, the church say that it's against closing the church is against actually fighting against Christianity, and they say we must not let it allow it, as Jesus won't be happy about it. And from your point of health side, what will your comment be on the statement the churches is making?
Yeah, well, this is very important that all of us as citizens, we observe the regulations, because this is a pandemic. It's not an easy thing. So it's a pandemic and it's affecting everyone. Whether you are in a tavern, whether you are in the church, whether you are in the mall, whether you are in the stadium. So yeah, and remember we are receiving different variants now in South Africa. We have the Deltas coming. We have all those. We are really, you see what happens in other parts of South Africa in terms of the Delta, and we are really afraid that, for example, in Free State, that we don't have it there. So it's important that all of us as citizens, we observe the country ways of combating the virus. Whether we are in the church, whether we are at our houses, whether we are in the malls, whether we are at the workplaces. That is why the levels are always there put for us to observe the level 1, 2, 3, just like that, so that we are able to say as people we are operating at this level to minimize the infections, because what is important now is the life of everyone. So yeah, that's a message from the Department of Health, and to say everyone should observe COVID regulations to minimize infections.
So you'd say it's nothing to do with Christianity that you guys are preventing the churches not to operate?
No. It has nothing to do with Christianity, belief, culture, and in any other issues that are protected by our Constitution of South Africa. We know that the Constitution is always very, very vocal on race, color, gender, and religion, and culture. So it's important that all of us observe the regulations that are put for us to minimize the infections, and we also prevent further spread of COVID-19.
Okay, so people, you get it from the Deputy Director of Health in the Free State that it's nothing to do with nothing. It's just that we need to minimize crowd gathering and keep to the protocol of what the country is requesting. Although there was a looter serious and it was uncontrollable. Do you want to comment quickly on that, on the looters? That was no social distance by then as a health?
Yeah, everybody has observed all these activities that happened. The important factor there is that we really had to observe people there. If we measure if we don't have a lot of infections, whatever, from any other gatherings that happen. So always, as health, we even go further now. We are looking everywhere where there's a funeral. We always want to go there and just check is everybody fine. And then we also asking everyone that after a funeral, can you check yourself after 4 or 5 days if there's nothing, because we know any gathering, it is causing us havocs.
Tell me, in other countries, people are paying to get vaccinated, and in South Africa, it's totally free. Do you want to comment on that?
Yes. We really, South Africa is really pushing a very, very, very on a high note to make sure that the population is protected. If you look at what happened, we move it chronologically. We started first with the frontliners, and then we come to the vulnerable populations, those people who are 60 years and above, and with comorbidities like your diabetes, your asthma, your hypertension. Then we come 50 years to 59. Now we are coming now to lesser vulnerable populations, your 35 years to 49. Now we are even coming to 18 years and going forth above. But we started first with those who are believed that very, very vulnerable, your healthcare workers and all that. So many people didn't understand why we started with the healthcare workers. The healthcare workers, for example, we are always exposed to COVID more than anyone else. And if we don't vaccinate ourselves, we are the carriers to other people when we come back from our workplaces, hospitals and all that. That's why we have to start with ourselves first to prevent from that, from ourselves. Then we come to all these different populations and all that. So we are really moving swiftly to make sure, even to go to, we already done the police, SNDF, DC, correctional services and all that. So we are really pushing harder to make sure that everybody is, we had herd immunity.
Okay. Voiceit went further and pay a visit at Universitas Hospital. Let's look at this video clip and we discuss it again.
So this is the area where we vaccinate the people. The area is divided into two, accommodating both the younger than 50 years old, as well as the older population that's older than 50 years of age. This site we're running 33 vaccinators at the moment, and we've done 804 people so far by 10 o'clock this morning. This is the area for resuscitation area, as well as those patients with mobility problems that are unable to walk through steps are kept in here for 15 minutes post-vaccination observations. This is our post-observation area situated underneath our vaccination site, and this is for patients who are mobile and able to climb stairs. They come down here for their 15 minutes observation, and there are two nurses in attendance at all times in this facility. as well as having all emergency equipment. This is our discharge area, so the patient is given information about their return date, possible side effects, what to do in the event of any side effects. We've had minimal side effects on this site, as we're keeping with all international data, and I would encourage you all to get vaccinated. If you look at countries that have managed to be vaccinated, how it's changed their curve, their mortality and morbidity. So please go and get vaccinated, and don't follow social media. If you want intellectual discussions, please follow one of the people who are well known and knowledgeable on this topic rather than social media accounts. Thank you.
Hallo, my naam is Jan van den Berg en ek is 'n boer van Deelswil. Ek wil graag almal aanmoedig om te kom vir hulle vaksin. Ja, so kan ons almal aangaan en dalk hierdie virus oorwin.
Ja, ek is Rina de Kok, ek is van Bloemfontein en ek sou aanbeveel dat almal kom vir hulle inenting. Dis my tweede een van Pfizer. Dankie.
Okay, good morning. My name is Johan Yigu. I'm here at University Government Hospital for my second vaccination on the Pfizer one. So I would just like to encourage everybody that, excuse my glasses, I would just like to encourage everybody that hasn't been vaccinated, please come in. There's a lot of people very sick out there and it's just a matter of life and death. So I've been through my first vaccination, everything went well, there was no trouble afterwards and I'm looking forward to get my second one.
I'm Paula Baines from Heidedal, Bloemfontein. I encourage you people to come for your vaccination. This is my second one, and I must tell you I'm feeling really well. There's nothing wrong with it. Thank you.
There we have seen your own people in your own province where you stay went for the vaccination. But my first question to you, Wesley, is that why do they first need to take your blood pressure? What is the reasons for that?
Yeah, it's just a precautionary measure to check your vital signs before. Although they are not really much necessary, but it's just for us to take a precautionary measure to make sure that we vaccinate people who knowledgeably we know that they are good in terms of to be vaccinated.
And your temperature, I see they also look at your temperature.
Yes, very important. We pre-screen people before they are vaccinated because we end up vaccinating people who are already having COVID. So it's important that we pre-screen them to make sure that they are clear in terms of symptoms.
The temperature must be 90 upwards, then you are safe.
It should be less than 37.5. Then you are safe in terms of.
And when you less than 37, you are almost dead.
No.
Not really.
you're still fine. Yes, it's just that for us to control. But what is very important again is that people must also check the symptoms before go vaccination. Your cough, your sore throat, your runny nose, any other symptom that is key before you go for vaccination, so that you not vaccinate whilst you already contracted virus.
And after you have been vaccinated, I see they got a 15-minute waiting, recovering period. Can you explain us?
It's very, very important to check if you don't react, because some of the people react to the ingredients of the vaccine. So it's very important that you check we don't have any reaction to the vaccine, or you don't develop any reaction. That's why we have to be put at 15 minutes post-vaccination site where you be observed if there's anything. Then after 15 minutes, if nothing happened, you are free to go home.
Okay, we see already on our YouTube channel there's a question that's coming up. On the Facebook there's still no questions. We're going to give you time to interact and ask questions Whilst we're waiting for your questions, we're going to take a short break with Brooks Hill playing some nice music on the guitar. Right, we got only one question on our YouTube channel so far. It's coming from Pastor Roland Mogaicho. He was also a guest some time ago on our program. He wants to know that there in the supermarkets and in the malls, there's actually no social distance. They just sanitize and you go in. They don't check your temperature. What is your response on that?
I think somewhere we dropped the ball a little bit. Remember when we started COVID first, March 2020, we used to be controlled when we go to the malls. I remember we used to stand outside the Pick and Pays of this world, the ShopRites, or whoever. We need to stand outside and be controlled to come in. I think we dropped the ball a little bit, and I think maybe it's advisable for them to also consider this, because sometimes it's where we get affected at the end of the day. When you observe, sometimes you observe when we said there's no sit down at restaurants, but if you look at how people cram themselves in the restaurants and all that, so it was also my concern that we need to look at that, how best we control it, because in the past we used to be controlled when we enter malls, when we enter shops, we'll wait for others to come in, and then we wait outside, then we come in. So I think it will be advisable for us to revert.
Now, how can you revert? What methods can you use as a health director?
It's for us to have talk to people, just to have talk to them, to show them that even though we are preventing, but now some of the areas you find that we still having more people crammed inside our area. So it's just to go and talk to people, show them that we still are in danger if we still continue coming in with a lot of numbers. But we are sanitizing, we are doing all that, but we are not really, when we are in the shops, there's no social distance, we are just mixing ourselves in between. So yeah, I think it's just for us to go and help talk to people.
Okay, there's a question that's also coming up. the people are saying that will people be allowed at venues if they are not vaccinated? Will venues allow them?
I don't think people will be discriminated because remember again, it's your choice to go for vaccination and all that. It's not like we are really compulsory that everybody must go. You still have any option, but we are encouraging everyone for herd immunity, because the more immune we promote herd immunity, the less we're gonna have a lot of community spreading and all that. So it's important that we take this as a very serious strategy to prevent COVID-19. So yeah, we encourage people to go for vaccination. We are not forcing anyone, but we are saying, please, let's go so that all of us have this herd immunity and we minimize further infections in the future.
Tell me, can your workplace force you to go for a vaccination?
No, they won't. They cannot do that. They are not allowed. It's against the law, against the Constitution of South Africa. So the thing is we free will of being health educated, be shown that how important it is, and then you go willingly and vaccinate yourself.
Other people are talking about the 666. If you go and get vaccinated, we are moving to the 666.
Okay. Oh no, that one is a myth. There's a lot of myths that people are talking out there that are causing confusion. And remember, sometimes in life, things that are not correct spread more than things that are correct. So it's important that we some of the things we keep them as is a myth, and then we adhere to the important information of us preventing the spread and making sure that we save lives. Remember, if we do that, we also save life of others. Once one person vaccinates, you save a life for other people at the same time.
This jab, is it going to move to a yearly thing for the rest of our lives, or if everybody is jabbed, will this virus die, or do we still need to continue with it?
I think the World Health Organization, the Center for Disease Control, and the countries will give direction. But at least when they look at some studies, they show that 8 months and above, we are still protected. And what is important again is that we always have different variants. Like now, look at your Delta, your Alphas. So we have different variants. So this will be guiding us going forward, whether we vaccinate, we continue vaccination or we annually, or just like your flu vaccine. But it will be guided by the more research.
A lot of people, families, a lot of their members have died, and it's a mental state that they went through. In the Voiceit, is there not a place where you can go to where you can mentally recover? There's people that have lost 4 family members at one stage, and mentally it's affecting these people very badly. Other people are losing their jobs. They don't have any income, and it's affecting them mentally. Is there any programs like that?
Except the fact that we are doing group therapies through psychosocial support that we're doing in our healthcare facilities. We are now building a call center for that part. I think Free State is busy building that call center. But if you go to facilities of health, there are specialized professionals who will also who are guiding all the people who are post-COVID, who are infected and affected by COVID, for psychosocial support in terms of group therapy and all that. So that's what we are doing also in our workplaces.
Okay, people there, we have got a lot of information from the Deputy Director of Health about the vaccination. Please encourage your people to go for this vaccination. It can just help, and it can save lives. And on this note, we would like to say thank you, Vesi Molete, for coming in and share this with us. If there's still of you that wants questions, Mr. Vesi is on our program on Voiceit. If you want to drop a later question in, he can respond to Voiceit. But thank you once again for the viewers that logged into our show, and please stay safe, keep your distance until the next time we are back again. Have a blessed evening.